In this video, we're going to explain the foot posture index. We're going to give an explanation to what it is. So the videos are not for demonstration purposes, but they're to assist in the explanation of this test. Also, if you need the scoring sheet, it is online, so you can search this on Google and find it yourself. So for this video, I just want to give like a simple overview of how to score this test. Of course, if we have a 0 to +5, that is a neutral foot, that's a normal foot. If we see +5 to +9, that's a pronated foot, and anything above +10 is a highly pronated foot. On the other hand, you have the minuses, which suggests supination at the foot. So -1 to -4 would be a supinated foot, and anything between -5 to 12 is a highly supinated foot. So let's get into the explanation of the foot posture index.
So in this illustration here, what you can see is I'm palpating the talar heads, and this is a talar head palpation. So essentially this is not done in subtalar joint neutral, this is done in a relaxed stance position. So we're trying to see if we can feel it more so on the medial side or the lateral side, or can we feel it both equally on each side. So for the next component, we're looking at the supra and infralateral malleolar curvature. So in a neutral foot, it has been suggested that the curve should be approximately equal. In a pronated foot, the curve below the malleolus will be a little bit more concave than the curve above due to the abduction of the foot and eversion of the calcaneus. The opposite is true in a supinated foot. It's also important to mention if the patient is obese or there is significant oedema surrounding the ankle joint, then it's probably best to discard this aspect of the test. The next component of this test would be assessing inversion and eversion of the calcaneus. So this is an observational equivalent of the measurements often employed in quantifying the relaxed and neutral calcaneal stance position. With the patient standing in a relaxed stance position, you can get a pen going down the Achilles tendon to give you an indication to whether if the calcaneus is inverted or everted, and then this is scored appropriately. After that, we can then assess the bulging in the region of the talar navicular joint. In a neutral foot, the area of the skin immediately superficial to the talar navicular joint will be flat. The T and J becomes more prominent if the head of the talus is abducted in rear foot pronation. Bulging in this area is then associated with a pronated foot. In a supinated foot, this area may be indented. And then the next one after this would be height and congruence of the medial longitudinal arch. While arch height is a strong indicator of foot function, the shape of the arch can also be equally important. In a neutral foot, the curvature of the arch should be relatively uniform, similar to a segment of the circumference of a circle. When a foot is supinated, the curve of the medial longitudinal arch becomes more acute at the posterior end of the arch. In the excessively pronated foot, the medial longitudinal arch becomes flattened in the centre as the mid-tarsal and the Lisfranc's joint open up. And on the last component of this test, we assess abduction or adduction of the forefoot on the rear foot, also known as two-many toe sign. When viewed from directly behind and in line with the long axis of the heel, not the long axis of the whole foot, the neutral foot will allow the observer to see the forefoot equally on the medial and lateral sides. In a supinated foot, the forefoot will adduct on the rear foot, resulting of more of the forefoot being visible on the medial side. Conversely, pronation of the foot causes forefoot to abduct, resulting in more of the forefoot being visible on the lateral side.
So thank you for watching the video. I do hope that helped you in kind of getting an understanding of what the foot posture index is. Of course, there's many other videos on YouTube that actually go through the whole procedure and how to conduct this. But I hope this gives you a guide to what we're looking for when we're performing this test.